Question, the member from Davenport.
Thank you, Speaker. My question this morning is for the Minister of Health and Long-Term Care. We know that our government has been committed to ensuring that Ontarians have access to high-quality, compassionate palliative and end-of-life care in their home or as close to home as possible. We also know that everyone in Ontario deserves to age with dignity. This has been a priority for residents of my riding of Davenport. Our government began investing in hospice and palliative care in 2005 when $115.5 million was invested in the end-of-life care strategy. Since then, we have been making massive strides, and we know there is still more to come. Our government is investing a total of $155 million in hospice and palliative care over the next 3 years, with last year's 2016 budget announcing a commitment of $75 million in additional funding over the next 3 years. Can the minister please share with us what these investments mean for the future of hospice and palliative care here in Ontario?
Thank you. Minister of Health, Long-Term Care.
Thank you, and thank you to the member from Davenport for giving me an opportunity to discuss the important investments that we're making in palliative care. And let me take the opportunity as well to welcome those joining us today from Hospice Palliative Care Ontario and thank them for their tireless efforts to ensure that every person and family in this province can quickly and easily access the finest standard of hospice palliative care when required, Mr. Speaker. And I'd also like to recognize my parliamentary assistant, MPP Fraser, the MPP for Ottawa South, who has been at the core of creating an Ontario-wide strategy for both palliative care and end-of-life care, Mr. Speaker. There has been no greater advocate for palliative care in this legislature than my parliamentary assistant and the MPP for Ottawa South, Mr. Speaker.
Answer.
He has travelled across the province to hear from patient groups, caregivers, diverse communities, and healthcare providers, and the result has been our strategy, Mr. Speaker.
Supplementary.
Thank you, Minister, for sharing that with us, and also thank you to the member from Ottawa Centre for his advocacy and great work on this particular file. Last month, our government announced a new program to support the creation of new and expanded hospices across Ontario. Through this program, eligible hospices can apply for significant capital funding to help with the construction or renovation costs of more than 190 beds that will serve more than 2,000 additional clients and their families each year. Residential hospices are so important as they provide expert care in home-like environment, giving families and friends the space and care they need to be with their loved ones at one of the most vulnerable times in their lives. Access to hospice and palliative care is so important to my constituents and so important to communities across Ontario.
Question.
Can the Minister of Health and Long-Term Care please inform this House of the other initiatives that will improve the hospice and palliative care in Ontario?
Minister.
Well, Mr. Speaker, we are currently funding more than 30 hospices across the province, and we've made a commitment to fund 20 more. We're funding their operating costs. We're funding capital costs as well with the new program announced this year. We're working with Hospice Palliative Care Ontario to expand access to training and important information about palliative care to caregivers who are caring for their loved ones at the end of their lives. We've increased funding for visiting hospice volunteer services across the province this year by more than $1 million. We launched the Ontario Palliative Care Network together with our partners at Cancer Care Ontario, at Health Quality Ontario, and the local LHINs. This network is now in the final stages of completing a 3-year action plan to ensure that access to high-quality palliative care is equitable across this province. We have a robust strategy informed by Ontarians, informed by stakeholders and advocates, and most importantly by families, caregivers, loved ones who are most effective, Mr. Speaker.